While the violence and looting continues in the country, another 633 people have died from COVID-19 in the past day. While this may not be our highest daily coronavirus death toll to date, it's not far from the 844 deaths recorded on the 6th of January. Meanwhile, our already overwhelmed healthcare system has in the past day been flooded with 619 more COVID-19 patients. The country has already recorded over 12,500 new cases, and this increase represents a 20.2% positivity rate. While Gauteng continues to dominate around 50% of the country's COVID-19 caseload, the mass gatherings and looting could potentially be seen as super spreader events. So what does this mean for the country's battle to get over this awful third wave? Well, to discuss this, we're joined by Professor Koleka Mlisana, co-chair of the Ministerial Advisory Committee on COVID-19. Prof, thanks so much for joining us. We were just saying earlier, this is such a difficult time for everybody in the country. How are you holding up with healthcare workers?
Good morning, Annika, and good morning to all the viewers. Thank you for having me. It really is a very, very difficult time, and I think for every South African, actually. As you correctly say, in the midst of the, the height of the wave, we then have these unrests. And obviously, I mean, it's just going to put more pressure. And the question that then we have to deal with is what is going to be the impact, on the numbers, new cases numbers. Because, I mean, as everybody can see, it's just massive, people with no masks and nothing whatsoever. And I think for me, the concern as well is, first, the fact that they are not using any, non-pharmaceutical interventions. And now, which is correct, it's what that should be done. Everybody who's found looting is actually being carried into police vans, into prisons. And the question is going to be, where then is going to be social distancing, use of masks in prisons? That's going to be another, area for transmission. So really, we need to gear ourselves up for probably an increase in cases in an already, existing and a failing, system, which we actually were going through during the third wave. So it really is a very grim situation.
Prof, there's added pressure with vaccination sites in the two provinces, KZN and Gauteng, having to close in some areas. Plus, you're seeing extra trauma cases coming into hospitals. How are hospitals actually coping with those trauma cases and with COVID-19 caseloads?
Annika, that's why it really just becomes so difficult. Maybe just to summarize what some of the issues that we're facing with is that with all this unrest, apart from everything else that they are causing, but they are actually causing disruptions at various levels. So there are disruptions at supplies, which is going to be whether it's medical supplies, be it, medicines, be it oxygen. We're all concerned about that. And also laboratory supplies, reagents. Are we going to be able to actually provide the testing that the country needs at the moment? There's obviously, as you say, the disruption in healthcare provision. Hospitals now, I mean, like for instance in KZN, how many healthcare workers are able to get into hospital and look after patients? We've seen surgeries broken down into, we've seen clinics, so really we are in a mess. And the question that you are asking is that how then are we going to cope? And we are very, very concerned because we had been struggling to ensure that the country was ready for the high numbers of admissions we're seeing with third wave. And now that we are seeing an additional strain on healthcare services, and as you say, lots of trauma patients that are now going to compete with, the health needs of patients with COVID, it really is a very serious situation. And I'm not sure how the department, how the health is going to deal with this and whether we are ready for that.
Prof, just last question. In terms of medical supplies, you were talking about Afrox has been affected. They supply oxygen. One of the big pharma warehouses was raided yesterday. Has there been an impact on the looting? Has looting had an impact on supplies for the medical profession?
Yes, there has been there's an impact. I mean, just the one that's glaring, in fact, Annika, is the fact that even with vaccinations now, we have had to close certain vaccination sites because of the unrest, and which is a huge blow for the country. At the laboratory aspect, in that now to actually get reagent supplies is going to be difficult. We need to check to see whether we've got enough supplies. So really, it is an acute issue, and it is something that needs to be assessed properly. And then we need to find out and explore how soon are we going to be able to replace those supplies, and whether it's going to be easy to do that. So it really is not a good situation whatsoever.
All right, Professor Koleka Mlisana, co-chair of the Ministerial Advisory Committee on COVID-19, saying the situation was dire before the mass unrest started. It's now escalated and has made life very difficult for healthcare workers and